Today at ELAB we're taking you through spinal anatomy and the impact of the spine on the rest of the body. It's part of the posture and spinal health segment of our ELAB education. We feel like it's really important because we're going to be discussing a lot of the issues that happen along with the spine and a lot of our philosophy around training. And so we thought that you should see inside your back and inside your spine. So just a quick orientation. The spine is made up of vertebrae, which are attached to ribs and then attached to the pelvis. The vertebrae is separated into three segments: the cervical, thoracic, and then lumbar. And then some people would say this is still part of the spine, but then the sacrum. The cervical spine has 7 separate vertebrae, all doing varying jobs, and they change from the top to the bottom. The thoracic spine has 12, and its main role is to house the organs and the lungs especially, and its attachments onto the ribs, of course, so 12 ribs, which we'll discuss a lot more of their importance in future videos. And then the lumbar spine, there's 5 vertebrae. The lumbar spine are obviously, they're a bigger vertebrae. They take a lot of impact forces, and we all know that lower back pain is super prevalent. So we'll get to the causes of those again in later videos. And then the sacrum, attaches to the pelvis, so we can imagine the sacrum is a continuation of the spine, and then these joints through here are the sacroiliac joints, where the sacrum joins onto the iliums or onto the pelvis. So I guess that's it for the bones. We'll talk about different orientations. Each of the vertebrae has a different role, whether it be more rotation component or more flexion extension, which is forward bending and backward bending. So in the lumbar spine, we see that there's a lot of forwards and backwards bending through this section through here, but they don't have a lot of rotation. There's not an ability to rotate, which will make relevant definitely as we go along. Thoracic spine, again, its main role is a rotator. It allows us to turn, and so it requires a nice stable base from the lumbar spine to do so. And cervical spine, it's got a lot of multi-planes of movement, so it flexes, extends, rotates, large amounts of lateral flexion as well, so quite a mobile area with different planes. The vertebrae are all separated by discs. I'll show you on this guy here. Discs, and discs are quite a famous thing in terms of injury and pathology. And the discs are made up of a cartilage substance, and we call it the annulus. You can imagine it's like a car tire which runs around, and it's full of jelly. So a car tire full of jelly, quite strong. If you can imagine the ligaments around your ankle, it's the same sort of material. It's the same sort of collagen that runs around through here. They're mainly to take compressive loads for the spine, running, jumping, sitting, those sorts of things. They separate the spaces between the vertebrae, okay? Really, really importantly, to allow the facet joints, these joints through here, which orientate the direction of flexion, extension, or rotation. So these facet joints, which sit on either side through here, are the things which determine how our spine's able to move. The discs allow us height so that these joints don't become degenerated early, but most importantly, they create space, or the vertebral foramens, intervertebral foramens, for our nerve roots to come out. So our spinal cord will run straight down through at the back of the discs, hence the fact it's no good when we get disc bulges coming backwards, and then the nerve roots come out and then go down our arms or our legs from this point through here. So disc height is really, really important, and we'll talk to you more about disc pathology and things that can go wrong in through there. But so discs, facet joints, really important in terms of compression forces, really important in terms of orientating how the spine's allowed to move. The ribs, when we're talking about the ribs, I'm really, really interested in talking ribs as a physiotherapist because they have such great leverage onto the spine. Archimedes says, give me a lever long enough and I'll move the world. These are quite long levers, and so you can imagine if things aren't moving well within your ribs, they're going to create huge changes in the position of your vertebrae. And so we call these the CV joints, or costovertebral joints at the back, and costotransverse. There's 2 joints through here. And at the front, when we turn them around, they join the sternum either straight onto the bone through the sternocostal joints or through a link of cartilage through to the lower ribs. And so obviously 12 ribs, the bottom 2 are floating, the other 10 are joined to the front and to the back. So they have a really, really large role in how the whole thoracic spine moves. And we're really, really interested in that because that has huge impacts above and below. The upper cervical spine also has a large impact on things like temporomandibular joint or jaw and headaches and so forth. Okay, so we'll discuss those things later. But that's essentially a quick rundown of your spine. If you're interested in specific things which go wrong with your spine, make sure you have a look at the spinal dysfunction videos.